Hello, everyone. My name is Solomay Tibabu, and I'm the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Kristian from Meru Health here, along with Dan from Moda Health. To get started, how about each of you, if you want to do a quick introduction?
Sure. I'm Dan Thoma. I'm a licensed professional counselor and senior manager of behavioral health for Moda Health, which is a regional insurer in primarily the Northwest region of the United States.
Hey everyone, I'm Kristian, the CEO and founder of Meru Health. And Meru Health is an technology-enabled telehealth practice focused on treating depression and anxiety and burnout.
Great, thanks so much. I think I'll start with Dan. Tell me a little bit about Moda's priorities around behavioral health in particular and how you got to them.
Great, thank you. Yeah, we got two main priorities for behavioral health. The first one is that we're passionate about getting people access to services that help them get better. And the second one is that we want our members to have a good experience in doing so. And there's a few pieces to that. When I was in graduate school, we studied all these different types of therapy. There's hundreds of different types of therapy, and it turns out that on the whole, all of them work, and all of them work approximately about as well as each other. But there's in particular one tool that can help all of those different forms of therapy work better than if you don't use it, and that's outcome-informed treatment, which basically just means paying close attention in a systematic way to whether the treatment that you're doing with each person that you're working with, whether it's working, whether they're getting better or not getting better, and what's their experience of that treatment, and really doing that in a formalized manner. And there's a lot of research that shows that providers who offer treatment that use this simple tool, outcome-informed treatment, it helps people get better at a faster and more consistent rate and more consistently than people who don't use that simple tool. And so that's one of the things that I'm really passionate about is making sure that our members have access to really that best practice. Another thing in terms of experience, people's experience in getting the treatment, from one perspective, it's a matter of customer service, how we treat people when we're interacting with them, and how both as an insurer and in terms of the providers that they work with. But there's another aspect to experience that's really come to the forefront, particularly in the last year, but in the last few years, in that it's really difficult for a lot of people to find a provider anywhere that will see them. I was helping one of my colleagues find a provider for their son. And I said to myself, well, I'll make a dozen phone calls a day until I can find somebody. And it took me 2 days before I got one response. So, 24 inquiries I put out there into the world looking for one person who could see somebody. And I got one person who had availability. So that experience of people, particularly if you're in a mental health crisis or if you're depressed or anxious, that's just really daunting. And so to be able to find ways to make that experience better is super important to us right now.
Great, absolutely. Now, Kristian, can you tell us a little bit more about Meru Health and what you do?
Yeah, thanks a lot, Salome. So yeah, Meru Health, we are a telehealth practice, but we also use technology. We have built a digital therapeutic, an app-based treatment program that is 12 weeks long. And we also incorporate a heart rate variability biofeedback device, which is kind of like a wearable device that people get alongside when they participate in the program. And yeah, we're focused in treating depression, anxiety, and burnout. And we have licensed marriage and family therapists and licensed clinical social workers, licensed professional counselors, as an example, in our kind of a care team. So we are also slightly different, that we're not just a platform as maybe, there's quite a lot of other companies that are all, kind of like a platform, but we're more like a actual clinic, although a virtual clinic. We reside in the cloud, but we have actual providers that are supporting every single member that comes through. And then also with the digital digital assets. And maybe final important point is that there's a lot of cognitive behavioral therapy, CBT, and there's a lot of different forms of CBT out there, and there's also medication for say depression. But we also realized with Meru early on that there are also other things that play a role in anyone's any person's kind of mental health situation, and there's a lot of things that the world is now learning that are about your gut and the gut bacteria, and like kind of what you eat, like food and mood connection, and also sleeping is important for human well-being. So, and depression and sleep always go together. So if you have depression, you always pretty much 95% you will have also sleeping problems. So we've kind of brought all these different modalities together with the Meru experience, so that people have a more holistic or more comprehensive array of things at their disposal. And then we customize care and help each individual get the best recipe from all of this to help them get better.
Wonderful. And I know you two have announced a really exciting partnership. It would be great to hear, Dan, from your perspective, what led you and Moda to select Meru as the partner to support your employers?
Yeah, certainly. So the first thing that caught my eye was really that it aligned well with that first point that I made in terms of what's important to us is services that help people get better and the use of outcome-informed care. So when I looked at the information about their program, I saw that they use the PHQ-9 and the GAD-7, which are a depression rating scale and an anxiety rating scale, on a very regular basis throughout the program, and they use that information to help shape the treatment. Also, as a result of doing that in such a systematic way, they were able to prove that their treatment is really effective. And so they had some peer-reviewed studies that had been published that demonstrated the effectiveness of the program. And they also were able to show that their engagement of people who enter the program is really great, and the retention of people in treatment is great. So psychotherapy is really helpful for many people, but most people who try it don't stick with it very long, and so don't stay with it long enough to really get the full benefit from it. And their data showed that they had an 85% completion rate. 85% of the people who started the program completed the program. So people were really getting the full benefit of that treatment. And another thing is that it's great to have an alternative to talk therapy and medication. Those are both really effective treatments, but they may not be the right fit for everybody. And so having a different way to achieve the same outcome is just a really great thing to additive thing to be able to offer to our members and our employers. And also, as you know, we had this conversation going over a period of months as we sort of courted each other, and just found that they were great to work with. They were super dependable and reliable. If we asked them something, they gave an answer that made sense. They said they were going to do something, they did it, and they did it as soon as or before they said they were going to do it. Just really a good working relationship from the start.
Well, Kristian, it sounds like you've got a great partner in your court. Anything you could add around effectiveness of your solution? I know Dan covered quite a bit, but anything you want to expand on that, just given that outcomes and effectiveness is so top of mind for many plans right now?
Yeah, thanks for asking. And thanks a lot, Dan. I mean, like, we feel the same. Like, it's been super awesome to work with you guys, and definitely like a very dynamic and great and reliable relationship. And we really highly appreciate that, and also appreciate the innovation, like that you're kind of really open for innovation. And that's so important for also everyone else also in the market and a lot of people out there to get benefits. But yeah, so what's happening with the research piece is that, like, that's kind of a fundamental thing where we actually, when we founded the company, we started from a point where, having been in healthcare for quite some time before already, myself and my co-founders, we realized that there's a lot of healthcare technologies and a lot of like newer healthcare technologies like digital apps and tools that may be effective or may not be effective, and they just haven't been studied properly. So the challenge is that there's just a lot of assumptions out there, and there's like a lot of apps in the app store that say that they are somehow addressing mental health, but they may not have been studied properly. So we felt that like that's not the kind of a company we want to become, and we really wanted to become someone or a kind of a company that does research properly, and because it's about people's safety and about the effectiveness of care. So we felt it's super important to do the scientific part rigorously. And so we started from doing clinical research in the early days, and we did clinical research with UC Davis and with Stanford later on, and with Harvard as well later on. So really partnered with top universities to make sure that like how we deliver care and how we treat people is effective and is safe and is feasible for different populations. So yeah, that's been kind of like our guiding light since the beginning, and yeah, we're super happy that there are folks like Dan and Moda who are also like reading the studies and are excited about it. So we appreciate that.
One thing I would add to what Kristian's saying there in terms of when we were looking at their program, I remember one of the early questions that I asked is, the research on psychotherapy shows that the relationship is the most important factor in determining how effective that care is. And I was kind of skeptical at first, this being a digital thing. It's like, well, where's the relationship between the provider and the member in this, knowing that that's really kind of what helps drive change. And as Kristian was saying, their program isn't simply a set of tools that a person goes out and engages with on their own. There is that relationship with the licensed provider that guides them through that experience. And that relationship happens in a different way than it does in traditional counseling relationship, because most of it's not face-to-face, it's mostly texting back and forth, but it's still there, and it still helps drive that change and that progress.
Totally. I'm a huge fan of provider-driven digital, and I agree that relationship can be maintained in a way that is convenient for members, but also maintains that relationship. So maybe this is a question for both of you. Perhaps I'll start with Dan and then Kristian. What are you generally just excited about in terms of behavioral health, tech, innovation, access, especially post-COVID? There's been so many changes.
Yeah, one of the things that the COVID era has really taught us is how amenable to telehealth and other forms of care behavioral health is in general. You can't get your back surgery done via telemedicine, but you can get a lot of help for behavioral health issues by telemedicine. And that's just been a really important lesson for us. And there's, traditional therapy can be delivered by telemedicine, but when you bring in a different form of treatment, such as what Meru offers, you get a couple of additional benefits, one of which is scalability. Kristian hasn't bragged about this yet, but I'll give him the opportunity to do so. But one therapist is able to serve more patients via this treatment method than through traditional face-to-face counseling, whether it's virtual or in person. So scalability and accessibility then going right along with that. Again, as I mentioned, that one of our biggest challenges is being able to get treatment to people who need it. And so the potential for technology to really help solve that problem is exciting for us.
Yeah, I mean, like from my perspective, I think that there's a lot of innovation coming out now. So it's like, with all the kind of negative sides with COVID and mental health that are unfortunately out there, and that's the kind of reality today. There's also a lot of positives, and one thing being that like innovation and the taking down walls and barriers for new innovations to come into behavioral health. That's definitely happening, and that's exciting. So there's a lot of I think personally I'm excited about kind of, as Dan said, the scalability piece is obviously been like really important for us. So we've built our solution in a way that one provider can currently treat 6 times more patients than in a normal, so like telehealth or face-to-face in-person relationship. So, just very briefly, the point is that if you're seeing people like this, like we're talking now, you can only see so many people a day if you do like 45 or 50-minute appointments. But again, like if you are doing more, so like combining like digital with chat with occasional video, you can actually then start seeing a lot more people simultaneously. So that's kind of an important point in the market because of the challenges with not having enough providers out there or not having enough capacity. But I think there's also other things that are super exciting, like a lot of the solutions that are helping us. Also personally excited about the kind of digital biomarkers and different biomarkers that are coming out. And what I mean by that is that there's basically ways from kind of taking your voice data or your facial expression data, or just like how you're how fast or slow you're typing, and these kinds of things are coming out now. A lot of research going on with like Stanford and others looking into these technologies, and that how we can actually determine from these digital biomarkers, like how people behave, how they type, or so, how well they're doing or how unwell they are. So these things can also have a tremendous impact in the future in like helping to better assess and better diagnose like what's really going on with the individual. And that's also like why it's important is because one of the major challenges in psychiatry has always been that it's really hard to know exactly like what's happening with this person, because it's based on your self report, like, hey, I'm feeling bad, or I'm tired, I'm like feeling depressed, I'm crying a lot, or whatever it may be. It's still your self report, and it's just kind of it's only that accurate. So one of the cool things is that there's more and more so like objective measures coming out also in the market now. So those are at least some of the things that I'm excited about.
Great. All of those are definitely exciting, and not to turn too Debbie Downer here, but there are still quite a few barriers in behavioral health. And so I'm curious to hear, what do you think our biggest challenges still are? And keeping in mind the audience that we have today, payers, employers, providers, tech companies, what do we have to do collectively to potentially address some of those things?
We could come back to a theme that I brought up a couple of times already. One of the biggest barriers that we have right now is access and workforce, and being able to get treatment to the people who need it and make sure that it's available to everybody who needs it. From a little bit more of an abstract point of view, one of the challenges is finding a way to pay for value as opposed to paying for activity. There's been a lot of talk for decades now in the insurance industry about value-based reimbursement. And in behavioral, and that's difficult in the best circumstances, but in behavioral health, it's particularly difficult, partly just because the way of our system of care is organized, it's very fractured. And so it's been very challenging to find ways to implement that principle of value-based reimbursement. And then I'll just touch on one other thing that's been a challenge for us in really building out innovative ways of serving people is coding. So the CPT codes and HCPCS codes, those are the two main kinds of codes that people use to bill insurance with. And those are very kind of activity-based, which comes back to the challenge in paying for value. And they're very restrictive in terms of being focused sort of on an old medical model and not so much a broader psychosocial model or technology-enabled model. And they're working on changing that, but finding the right ways to structure reimbursement using codes that exist and trying not to misuse goods too much, but still be able to capture the activity and the value that providers are offering is an ongoing challenge for us.
Sorry, what was the question? I was totally immersed in Dan's points about value-based care, and
No worries. Yeah, just to refresh, there are still quite a few barriers in terms of behavioral health access in general. And so any comments on that? What barriers are we still working on? And especially with the context of our audience here, how should they be involved in the solutions? Payers, employers, providers, technologists, startups, investors?
Yeah, totally. Thanks a lot. So I mean, yes, maybe starting from what Dan said, I think that I totally agree that like there's also like challenges in, many challenges in healthcare in general, but like value-based care is definitely something which kind of like makes so much sense, and it's still so rarely implemented, even in the physical health side. And it's a lot harder, like Dan said, also for behavioral health. Like, how do you measure results in a kind of a reliable way? That's definitely going to be a challenge. But like taking steps in that direction will eventually allow us to, focus on things that actually work better and that work better for long term, which will then start reducing also like relapse of care. Because one of the things which is kind of a big challenge here is that we treat people with ineffective methods today to a large extent, unfortunately, and those ineffective methods then make it so that like people come back in 1 or 2 years because they relapse again, having more similar problems, maybe like their second bout of depression or second sort of like episode or whatnot. So I think that's actually also one fundamental problem, that we're seeing so much repeat usage or repeat volume because of like not being able to provide people with effective and suitable care, like something that like like what Dan said already earlier, like something that works for other people doesn't work for other people, and it's really important to provide a selection of different interventions and better learn to understand what works for whom, and then reinforce those models, and that can happen through value-based payments. And then I think the other thing is just like that we're seeing a lot with Meru is that access to care, obviously, like it's largely about stigma also. Stigma is still a big challenge. So tackling stigma together as a society, that's what we can all do together. So and all the different stakeholders can participate there directly. So that will help a lot. But then when people seek care, then it's instrumentally important that we have capacity. I mean, like that's unfortunately one of the biggest problems today, and different innovative ways on how can we maybe scale care, like what Meru is doing, like using technology to scale care, or a single provider's capacity to giving them like superpowers so that they can actually see much more people. But then there's also kind of other ways, like how can we maybe bring kind of other types of like roles into the care team, so to say, like maybe care coordinators can help alleviate some of the burden. Maybe there are coaches that can also help alleviate the burden. Maybe there are just like actually more people or different roles that could help. And it's just important that we study these things properly so that we don't just like kind of throw in the things and then, it shouldn't be a human experiment. You know what I mean? Like we really like need to study these things before we do stuff. But I'm sure that there's going to be a lot of ways how to alleviate some of these struggles, some of these kind of pain points, also by bringing in other roles to the sort of like behavioral health care team.
Speaking of future, Kristian, could you give us a sneak peek on anything in terms of where Meru Health is going?
Yeah, so I'm excited to talking about the future stuff and what's kind of cooking at Meru Health. So we just recently launched a new coaching product, which is basically a coach-led digital intervention for prevention of mental health challenges or mental illnesses. So this is something we're super excited about, and it's kind of now getting out there through various channels with various partners that we've also announced recently. And it's about bringing people access to preventative solutions and teaching people skills and sort of like competencies for self-regulation and for emotional intelligence and things like that to help prevent further decline. Because sometimes, like, you know, stress is a really, like we all know, stress is really a big problem for a lot of people. But you can learn to regulate stress, and you can kind of make it your friend in a way. Like, it can also serve you. But if it's out of hand, then it can do a lot of havoc and a lot of sort of like harm. But that's kind of one of the key focuses for our preventative program, is like really helping people self-regulate stress to prevent further decline of, you know, kind of other sort of like onset of things that would happen from there. So super excited about that.
Any final parting words you'd like to share with our audience?
I mean, we're just super excited about the partnership that we have with Meru, as you know, as one of our offerings to enhance the mental health of our membership and our employers, and just really look forward to continuing working with them.
Thanks a lot, Dan. Yeah, and we're likewise super excited about our partnership and working with you guys. And also, like, just would want to say to everyone out there that evidence-based care, doing research properly, is really important, and it's going to serve the whole community going forward. So I think that's something I always want to emphasize. So thanks a lot for this opportunity. Thanks for having us, Salome.
Thank you both for sharing about this exciting partnership. Really looking forward to hearing more, and hopefully the model can continue to scale to other partners and beyond. Have a great day, everyone.
Thank you, Salome.
Thank you. Bye-bye.